Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today, we will be studying a very small topic of simple renal cyst. You can be asked a short note or a very short note type of question, like either it can be a 5-mark question, either it can be a 2-mark question. It will never be a long answer type question. Okay, let's study. So, simple cysts are basically benign fluid-filled cavity in the kidney. These are your beautiful two kidneys. So, there will be some cyst like this. This is your cyst. The cysts are benign and filled with fluid. Unilocular, thin-walled and filled with clear and straw color fluid. Straw color is like a yellowish tint of color will be there. It does not communicate with the collecting system. If I talk about the epidemiology, then it is most common cystic lesion of the kidney. Most common incidences in less than 40 years, the incidence is about 5%. If the age is more than 50 years, the incidence is about 30 to 50%, and mainly a male dominant. Just like we live in a male dominant society, the simple cyst is also male dominant. Okay. What is the etiology and pathogenesis? See, most of them are mainly sporadic, but the exact cause is unknown. Obstruction of renal tubules will be there if there will be obstruction. If there will be obstruction, what will happen? There will be dilation, as a result of which there will be cyst formation. Then, aging related tubular basement membrane weakness. Okay, aging is related to if the age of the person is very much, if the age is let's say 60 to 65 years, then that person is more prone to developing this kind of disease, right? Let's talk about the pathology. In the gross, there will be solitary. See, solitary means single and a solid. Okay, or multiple. There can be solitary means single, or there can be multiple, thin-walled, smooth, cortical, round, oval and clear fluid. In the microscopy, you will be able to see what? They are lined by single layers of flattened cuboidal epithelium. See, I am zooming, okay? Here what you are able to see, you are able to see there is intestinal fibrosis. This cyst is basically a fluid-filled cyst. This cyst is basically a fluid-filled cyst. What are the clinical features? In the clinical features, it is mainly asymptomatic, but there can be some incidental findings. Rare symptoms are there. There will be flank pain, palpable mass on doing the abdominal examination. You will be able to appreciate the palpable mass. There will be hematuria, there will be blood in the urine and hypertension. What are the investigations? The first investigation should be your ultrasound. It will be anechoic. Anechoic means there will be no acid sound that will be there, no as such of movement that will be there. Thin-walled and posterior acoustic enhancement. There will be posterior acoustic enhancement, although it's not needed at your level to know in this much of detail, but I'm just telling you, okay? And the shape is round or oval. In the CT scan, you will be able to see there will be water attenuation and no septations. Calcification will be there and enhancement. If the calcification is there, there will be enhancement that you will be able to appreciate. You have a classification called as a Bosniak classification. That we will read in our surgery. What is Bosniak classification? In your surgery, you will read in more detail, but let's just read it here also. The first one, you have first to fourth classes. Okay, in the first one, the cyst is simple cyst. And there will be no septa, no malignancy, no follow-up. Second, there will be mildly complex and thin septa. Two things. Third one, there will be multiple septa, multiple thin septa. Minimum thickening. In the second one, there was no thickening. In this, there is minimum thickening. It is hyperdense. Hyperdense malignancy. In the fourth one, you will be having, there will be enhancing solid nodule. There will be the rising superstar that you will be able to see in the fourth stage. For the complication, the first complication will be the complication of hematuria or the hemorrhage, sorry. Okay, hemorrhage, in that you will be able to appreciate that there will be hematuria. Second complication will be that of infection. Like there can be cyst abscess, there can be fever, or there can be pyuria. Third one, there will be rupture. Fourth one, there will be mass effect. And malignant transformation. It is rare. What is the management? You have management for two kind of people. Either the patient is symptomatic or either the patient is asymptomatic. For asymptomatic, you have to observe the patient only. For symptomatic, there should be percutaneous aspiration plus or minus the sclerotherapy you can give. There will be laparoscopic or open cyst decortication, and following up with the classification that we have read is must. For the prognosis and key points, it is excellent. The prognosis is excellent and most remains in the benign and the asymptomatic stage. Recurrence is rare after the decortication. The key points for your exams are: it is benign, cortical, thin-walled, clear fluid, asymptomatic, ultrasound and CT findings that you need to remember, and Bosniak classification that you need to remember. See, it will be asked as a short note or either it can be asked as a very short note. Not expected that it will be asked as a long type of question. That is why I have not taught you this in much more detail. This is sufficient. At your level, this is sufficient. Okay. If you're having any sort of doubt, please feel free to reach me. Please feel free to DM me. Thank you.